I want to thank you for your leadership during this coronavirus outbreak, and thank you for the kind words about the FDA staff. We have 10,000 scientists, doctors, and others, and more than that, working around the clock to aid the American people in this fight against the coronavirus, and those words are very much appreciated, sir. So before the President nominated me and I was confirmed as Commissioner of Food and Drugs, I was a cancer doctor, and I've sat across from countless number of patients and had to talk to them about their diagnosis and their treatment. And one thing that was really important is to provide hope. I have great hope for how we're going to come out of this situation. What's also important is not to provide false hope, but to provide hope. And as a doctor, that's the way I come to this. I'm speaking now to the American people as Commissioner of Food and Drugs, but that part of me has not left. Just look at the way the American people have responded to our calls for mitigation, for social distancing. The American people have great resiliency, and I'm so incredibly proud of how the American people have responded. As the President mentioned, he asked us to be aggressive, to break down barriers to innovation, and to accelerate the development of life-saving treatments. And we're doing that at the FDA. The FDA is committed to continuing to provide regulatory flexibility and guidance. But let me make one thing clear. FDA's responsibility to the American people is to ensure that products are safe and effective. And yet we are continuing to do that. Our folks and their tremendous professionals are working day and night to do this. You just can't even imagine how much they're working to provide this support for the American people, and I thank them. Since early January, long before the first domestic case, FDA began working in collaboration with CDC. I also want to note that we stood up an incident command group and have been focused on the coronavirus since the very beginning of this public health emergency. This is, in addition, an all-of-government and all-America approach, and I'll describe what I mean by that in terms of the development of therapeutics. An important part of that work is expanding the potential therapeutic options associated with coronavirus, and we've learned from our colleagues across the globe about this. But I want to focus on one thing. I was a cancer researcher before all this, and one thing I know about this great country of ours is that we have unbelievable innovators. We have people who every day, it's their job to develop treatments for all sorts of diseases. We are incredibly blessed as a country to have this. And as is true in any illness, these great American innovators, academia, private sector, they have engaged us about the best possible treatment options. We are looking at everything that's coming across our desks as possible treatment options for coronavirus. And we're extremely encouraged by the interest and the promise that we've seen from these great American innovators. Now again, we need to look at it. We need the data. We need the information to make the absolute best decisions for the American people. But I want to assure you, we have over 17,000 people at FDA who are doing this every day. We need to make sure that the sea of new treatments will get the right drug to the right patient at the right dosage at the right time. As an example, we may have the right drug, but it may not be in the appropriate dosage form right now, and that may do more harm than good. Those are the things that's our job to look at, and that's why it's really important we have these dedicated professionals looking at these aspects of therapeutic development. At the same time, we're also working through different mechanisms to actually get drugs into the hands of providers and patients. The President mentioned this, but one of the mechanisms is called compassionate use. Let me just tell you about this. If there's an experimental drug that's potentially available, a doctor could ask for that drug to be used in a patient. We have criteria for that and very speedy approval for that. The important thing about compassionate use, and that's what the President meant, this is even beyond right to try, is that we get to collect the information about that. Because one of the things, and our promise to the American people, is we will collect the data and then make the absolute right decisions based upon those data about the safety and efficacy of the treatments. We are working expeditiously, and we are working to make sure that these products are as safe and effective as they possibly can be. Let me tell you about a few things that we're currently working on. And this is a plan that was developed with many of the people at this table, our infectious disease experts on the task force. In the short term, we're looking at drugs that are already approved for other indications. So they're already approved, as the President said, for other diseases. As an example, many Americans have read studies and heard media reports about this drug chloroquine, which is an anti-malarial drug. It's already approved, as the President said, for the treatment of malaria as well as an arthritis condition. That's a drug that the President has directed us to take a closer look at as to whether an expanded use approach to that could be done to actually see if that benefits patients. And again, we want to do that in the setting of a clinical trial, a large, pragmatic clinical trial, to actually gather that information and answer the question that needs to be answered and asked and answered. Let me give you another example. There's a cross-agency effort about something called convalescent plasma. This is a pretty exciting area. And again, this is something that we have given assistance to other countries with as this crisis has developed. So FDA has been working for some time on this. If you've been exposed to coronavirus and you're better, you don't have the virus in your blood, we could collect the blood. Now, this is a possible treatment. This is not a proven treatment. Just want to emphasize that. Collect the blood, concentrate that, and have the ability, once it's pathogen-free, that is virus-free, be able to give that to other patients, and the immunoglobulins, the immune response, could potentially provide a benefit to patients. It's another thing that we're looking at. Over the next couple weeks, we'll have more information that we're really pushing hard to try to accelerate that. That's in the sort of more medium short term, and that'll be a bridge to other therapies that will take us 3 to 6 months to develop. And this is a continuous process. There is no beginning and end to each of this. This is, we're pushing this through. The other great thing about the great innovators of America, some of them tell us it's taken us years to develop therapies. They're looking at pushing that to the months period of time. And we're trying to provide them the regulatory flexibility, but at the same time the scientific oversight to make sure that gets done in the best way possible for the American people. The President mentioned that there is a vaccine trial currently being performed. It's a phase 1 trial, so it's the earliest study that gets done. We expect that to take 12 months to get to completion, to actually a time where we could approve a vaccine. But these are all things to bridge to the prevention part of this with a vaccine. It's exciting work, and the President is right. This is record time for the development of a vaccine, and impressive public-private partnership. The FDA's efforts to facilitate the development of these products are focused on ensuring timely access while also meeting the agency's world-respected gold standard, relying on strong data from clinical trials to determine if an experimental or an off-the-shelf drug that's used for something else can safely and effectively treat patients. We want to assure the American people that FDA is all hands on deck, as the President mentioned, these efforts, and continue to work with interested sponsors to help expedite the work. We remain steadfast in helping to foster the development of safe and effective therapies for COVID-19. Thank you.
Thank you, Mr. President. The White House Coronavirus Task Force met this morning, and on this very first day of spring, we continue to make steady progress toward President Trump's objective not only to marshal all the resources of the federal government, every state government, every local health official, but also to harness the power of the American private sector, and activities over the last day reflect all of those priorities. Yesterday, the President spoke with America's top physicians and nurses and garnered helpful insights about how we can best serve those who are serving Americans that are dealing with the coronavirus. We also had a productive call with over 5,000 state and local officials explaining the federal government's approach and our strong and seamless partnership with all 50 states and the territories. Last night, as you heard, the President signed the Family First Coronavirus Response Act, which provides free coronavirus testing, paid sick leave, family leave for caregivers, and food assistance for the needy, among a broad range of benefits. And today, as the President indicated, we expect that the Senate will begin work on an economic relief package. Later today, the President and I will meet again in a teleconference with the nation's governors. We will meet at the National Response Coordination Center at FEMA and outline President Trump's decision to have FEMA take the lead in our national coronavirus response. Our nation's response through FEMA will be locally executed, state managed, and federally supported. On testing, we want the American people to know once again that testing is available in all 50 states and is becoming increasingly available literally every hour of the day. Because of the public-private partnership that the President initiated several weeks ago with major commercial labs, I'm pleased to receive a report today that tens of thousands of tests are being performed every day. And with the passage of last night's legislations, state and private labs are now required by law to report all coronavirus testing directly to the CDC, which will give the American public and also give our researchers timely and important information. It's important for every American to remember that if you don't have symptoms, you don't need to get a test. We want to make sure that testing is available for people that are experiencing symptoms or have a genuine concern about having been exposed to someone with the coronavirus. Dr. Birx will address county-level data as well as the progress we've made on testing, and Americans can expect to see how an increased number of cases as our new testing system comes online should not be a cause of concern. She'll explain the importance of taking into account our new testing system as new data arrives over the next several days. On supplies, a priority the President has given to our task force, we continue to work with healthcare providers, businesses, and state leadership to identify available supplies, not merely in the federal stockpile, but much more importantly, available across the private sector. We're encouraged to see companies like Honeywell and 3M that I visited a few short weeks ago take advantage of the changes in the law last night that allow the sale of industrial masks directly to hospitals. Those companies have now greatly increased by the tens of millions their production of so-called N95 masks that will give our healthcare workers the protection that they need to minister to those that are dealing with the symptoms or the disease of coronavirus. Following the signing of last night's bill, all of those masks now have liability protection, and the companies can sell industrial masks to hospitals. It is encouraging, as we called out yesterday, to see construction companies all across America that are, as we speak, checking their supplies and donating those industrial masks to their local hospitals. And I know I speak on behalf of the President, who spent a lot of time as a builder, when we thank builders across America for partnering with our local healthcare officials. On the subject of ventilators, we're working with healthcare providers around America and suppliers, and we're encouraged to learn that we've literally identified tens of thousands of ventilators that can be converted to treat patients. And we remain increasingly confident that we will have the ventilators that we need as the coronavirus makes its way across America. And as we said before, we're all in this together. And before I step away and give the podium back to the President and to Dr. Birx, I want to call every American's attention again to the President's 15 days to slow the spread. We continue to hear one case after another, one city after another, where people are putting into practice the principles that the President outlined this Monday. And make no mistake about it, that while for the American people as a whole the risk of serious illness remains low, these guidelines should be practiced by every American in every community, not only to lessen the spread of the coronavirus, but to protect the most vulnerable among us. And I think Americans from their hearts are not only practicing these principles of social distancing and avoiding social gatherings of more than 10 people, using drive-thrus at restaurants, to protect their own health and the health of their family. But they're also recognizing that no American wants to inadvertently convey the coronavirus to someone for whom the consequences could be quite serious. At the President's direction, we'll continue to marshal all the resources of government at every level. We'll be reiterating that strong partnership with America's states this afternoon, with America's governors, pulling all of the private sector energy together, the innovation that you just heard described. I know on this first day of spring that we'll get through this, and we'll get through this together.
Thank you. Thank you, Mr. President. So I know you're watching the data carefully. You can see the dramatic increases in the number of new cases based on our ability to test additional people. And this will continue over the next 2 to 3 days as we begin to have backlogs reduced of the testing. You all have heard the anecdotes of people waiting 5 or 6 days for their test results. We are moving through all of that as well as testing individuals. I really want to applaud the frontline healthcare workers, the nurses and the doctors and the testers that have really prioritized, and the American people who have prioritized those with symptoms. The number of test positives is increasing. That is a dramatically important signature that everybody is doing their job. Those with mild symptoms are staying home, self-isolating. Those with serious symptoms are coming forward to getting testing. Our test positive rates are now into the 10 to 11% range. That still means that 90% of the illnesses out there, even the severe ones, are not COVID-19. I know many of you are looking at the state level data. Still over 50% of the cases come from 3 states. This is why we continue to prioritize testing in those states. In addition, 50% of the cases come from 10 counties. We're a very large country with very many counties, and I just want to applaud the local and state governments that are implementing their emergency operations centers and plans to ensure. I want to also really thank the healthcare workers that have been asked to reduce all elective surgeries, medical, and dental visits. This will dramatically increase the number of ventilators that are available in hospitals, but also in ambulatory surgical centers that can be converted and utilized. And also to the construction industry. We are deeply grateful the number, as Vice President said, the number of individuals have come forward with their construction masks, their booties, their Tyvek suits, and their masks to contribute them to the healthcare sector. The President's request to make this available in that legislation changes the ability and increases our availability immediately by in the 75 to 90% range because of the amount of construction use of those elements. Thank you.
Thank you, Mr. President, Mr. Vice President. Today, you heard a wonderful announcement from the FDA, and I just want to give a shout out to Steve, Dr. Hahn, and the folks at the FDA where several hundred of my Commission Corps officers work. You're right, Mr. President. They are tireless. They're doing things that have never been done before to bring the most prudent advances to the American people. But I want to talk about something different briefly. We know many of you are home practicing the President's guidelines for social distancing. But one thing we should all consider, especially our millennials and Gen Z, is donating blood. As an anesthesiologist who still practices at Walter Reed taking care of our wounded warriors and our soldiers, I know donated blood is an essential part of caring for patients, and one donation can save up to 3 lives. Blood centers are open now and in need of your donation. I want America to know that blood donation is safe, and blood centers are taking extra precautions at this time based on new CDC recommendations, including spacing beds 6 feet apart, disinfecting surfaces between patients, temperature checking staff, and encouraging donors to make appointments ahead of time so we can space them out. Social distancing does not have to mean social disengagement. So give blood today. You'll feel good about it, and you'll be helping your country and your community during this crisis. And you might even save a life.
President, switching to the efforts to boost the economy with the measures before Congress, will you guarantee that the money, the billions, the tens of billions of dollars, hundreds of billions of dollars even that's going to go to these industries will not go to executive bonuses or to more stock buybacks?
You enabled, I guess is probably the best way to put it, the Defense Production Act yesterday, but you didn't pull the trigger on it. You're getting a lot of calls on Capitol Hill from the Democratic leadership to pull the trigger on it. Why? What's the rationale for not doing it? Under what conditions would you put the Defense Production Act into action? Any idea when remdesivir will be available to the market? And are there any drugs in the pipeline that you believe could qualify for a treatment IND?
So with respect to the first question, I'm prohibited by law to disclose confidential commercial information. What I can tell you is we're working very closely with the company on this, and we'll have additional information. They will relatively soon. Yes, there are drugs in the pipeline. We're looking at every one. Everyone on this dais gets calls every day, as do all of our people at the FDA, about potential therapeutic options. We are looking at every single one of them.
Two questions for you. One on coronavirus, but just really quickly, are you confirming that Austin Tice is still alive? And on coronavirus, speaking of shortages of supplies, the CDC has put out guidelines for hospitals that are dealing with a shortage of masks to use them beyond their shelf life, reuse them instead of getting new ones, and in a worst case scenario, use a bandana instead of a mask. How is that acceptable at all?
I can't emphasize enough the incredible progress that was made with the passage of the legislation last night. The President had me go to Minnesota and meet with 3M that manufactures these N95 masks a few weeks ago. And we learned of their production at that facility of 35 million masks a month. Less than 5 million of those were qualified to be sold to hospitals. So the President worked with Republican and Democrat leadership. We've extended the liability protection. So now that all the industrial masks that are manufactured as N95s are now available to hospitals, and we're seeing a dramatic increase in production. Honeywell alone is repurposing a factory that was destined for Mexico to produce another 120 million masks per year. 3M is increasing output to 420 million masks per year. We've put a priority at the President's direction on making sure those that are providing healthcare services to America have the protection to keep themselves and their families safe. And with the legislation last night, with the incredible response among these great private sector companies, and as we mentioned repeatedly, with construction companies around America heeding the President's call to donate their industrial masks to hospitals. It's happening all over America. We know we'll meet that need. Well, as I mentioned, 3M is increasing their output to 420 million a year. At production in January, they make 35 million per month at that facility. And we're prioritizing the distribution of those. But the other thing, and we'll emphasize this with governors this afternoon, is we're working with governors to make sure that the healthcare providers, the hospitals, and the clinics in their state are placing orders now that this tremendous increase in supply, particularly with industrial masks, is now available. We're going to make sure they understand that the supply has greatly expanded thanks to a bipartisan legislation and the accomplishment of the President. And the response by these companies is making more masks available. And we're going to make sure healthcare providers are purchasing those. And the federal government will also make sure that our stockpile properly reflects those increases as well.
So, on the President's question, when will those masks be ready for, because they need them like today?
They're available now. The 3M facility that I was at told me that in January they went to full production on 35 million masks. The legislative change means that all 35 million of those that started to be produced at full capacity in January can now be sold to hospitals. That's the distinction here. It's a very important change, and it's part of the way the President has been engaging the private sector, pushing the kind of regulatory reform and the kind of liability reform that has greatly expanded the availability of masks. So they're in the marketplace now. We're going to make it clear to governors, as we made it clear to healthcare providers in conference calls yesterday, that those resources are now there. We've vastly increased the supply of medical masks, and we're going to continue to put a priority on making sure that we're calling on industry at every level, calling on major suppliers that the President met with this week to make sure that those personal protective equipment are there.
Mr. President, thank you. Two for you and one for Dr. Hahn. The American Hospital Association just told NBC News that they need $100 billion in order to address shortages in equipment and other infrastructure there. You just signed 2 legislative packages. They say it didn't directly give money to address this issue. Why not? Can you bottom line people, when can Americans expect their lives to go back to normal? You did say a few days ago, though, you did have a sense that this was a pandemic that was coming. So why was the United States not prepared with more testing?
So it's not just masks. Doctors are saying now that they are desperate for other personal protective gear, gloves, other equipment. Governors are saying that they don't have access to respirators and they're terrified. What is your reticence about invoking the Defense Production Act?
I've done it.
Could you explain the gap for the American people and what you're saying here today about there being tens of thousands of tests available, about how there being a huge amount of masks available, and what we're seeing on the ground, which is really the opposite of that? People are saying that they can't get tested even when they have symptoms. People are saying that doctors are telling us they don't have access to vital equipment. Can you explain that gap?
Dr. Hahn?
Mr. President, there seems to be a backlash building among congressional Republicans and then your supporters about a corporate bailout. In particular, Senator Mike Braun said that this could harken back to 2008, where we're picking winners and losers, and he indicated that he and some of his colleagues may not be comfortable with that.
We're hearing the State Department is going to put out an advisory telling Americans not to travel overseas at all.
I wanted to ask Dr. Hahn about today's announcement, if I could.
Please.
Dr. Hahn, thank you so much. I wanted to ask about remdesivir, if I hope I pronounced that correctly. Can you say, is it currently approved for use on the virus?
So remdesivir, and it's a drug made by Gilead, that's been in the press. It is currently in clinical trials here and around the world. We have also made it available by that approach that I told you called compassionate use, where a doctor could ask the FDA for that. And the really positive thing about that gives it rapidly to a doctor and a patient, but it allows us to collect the data, because what we really need to do is understand what the data and science are in order to make the appropriate decision about safety and effectiveness.
So how do you just make sure that it is safe? And I mean, is there any concern at all that it will be safe, considering that it's not going through the normal process and could potentially cause negative effects? Dr. Fauci earlier talked about we do not want to put out anything that could cause negative effects. Is there any concern about those kind of things with this drug? Sir?
Yeah, thank you for that question, because I just want to be clear about this. Remdesivir is going through the normal process. We are using our internal processes at FDA to set up with the company the protocols to actually collect the data. And you're right, we need to actually know about the safety and the effectiveness, and that's done through the clinical trial process. So it's those data that are going to inform the decisions that are ultimately made about safety and efficacy. This is an unprecedented situation. This is a really significant time. And one thing that, with the President's leadership, FDA has done is said, okay, how do we approach these extraordinary times with extraordinary measures, knowing that we have a sacred trust with the American people about safety and efficacy, but still at the same time enable these treatments to get into patients, and that's what we're doing.
How likely is it that the 15-day guidance that you have put through will be extended? Dr. Birx indicated that there are 3 states and 10 counties, if I got that right, where 50% of the cases are focused. Should those areas be doing more measures such as shelter in place? What your plans are for government workers? Are you moving for the government as well to start doing more teleworking?
Mr. President, if I could, on China, they reported for the first time since the outbreak no new cases over a 24-hour period. Do you have any reason to disbelieve them? And second to that, the National Security Council yesterday put out a tweet very critical of the Chinese government, saying the Chinese Communist Party suppressed initial reports on the Chinese virus and punished doctors and journalists, causing Chinese and international experts to miss critical opportunities to prevent a global pandemic.
You've been talking about China quite a bit, and you've been talking about the Chinese virus, how if you had heard about this on day one and had more information, possibly you could have stopped it.
Big difference.
Are you thinking about any types of repercussions for China, and are you also rethinking sort of the supply lines for our manufacturing industry?
American workers across the country are losing their jobs at an unprecedented rate, and your former economist said we could see some of the worst job numbers ever. Is the government prepared to see this spike in unemployment?
Members of Congress are now being tested positive for. Members of Congress are now being tested positive for coronavirus, and you have almost 24 who are self-quarantining. Do you have any guidance for Congress? Should they keep going to the Hill?
Do you support the idea of the government taking an equity stake in certain companies? Airlines or Boeing or what?
These 2 members of Congress that have tested positive for coronavirus, these will be votes that you need to pass this $1 trillion stimulus package for the economy. Do you expect this to slow down the delivery of checks for American families? And are you considering any executive action?
Right now, the economy is essentially ground to a halt.
Thanks for telling us. We appreciate it.
Stores have closed. Travel has slowed down.
Go ahead. What's the rest of your question? We know that. Everybody in the room knows that.
The question is, how long should those who are either not working right now or business owners who have to make critical decisions, how long should they expect the state of affairs as it stands at this moment to play out? And for all the parents that are home right now, and this is a question for Dr. Birx or Dr. Adams, who are caring for their children and are curious as to when might my kids be able to go back to school, what do you think is a realistic timeline?
Well, I think all of those decisions are made at the state and local government level, and each state and local government has handled it differently. That's why we put out from the president federal presidential guidance to every single person about what we think is important for the next 2 weeks. And as we look at that data, we'll be able to see if it's having an impact. I think you've all seen the modeling studies. Those were driven by the modeling studies showing that if you add these things together, they have a bigger impact than separately. And so those are part of the decision making. We had a whole group of modelers in yesterday. They're compositing all the data together to look at this carefully because everyone has those same questions of what the impact will be and what pieces could essentially be removed and you still have the same level of impact in decreasing the spread of the virus. The absolute key to this, though, is every single American looking at the president guidelines and taking it seriously. The acts of selflessness that I am seeing are so impressive across the board. But if even 10 or 15% of the population decides that what they're doing today is more important than the health and welfare of the rest of the Americans, they can spread the virus in a very strong way because you know the level of contagion.
What is your message for some leaders in Latin America, like the president of Brazil, who just on Sunday was taking photos with supporters and encouraging mass demonstration? And just yesterday, the president from Brazil said that we should not be surprised if we see him in the next few days in a crowded subway in São Paulo or in a bus in Rio, because he is the president and should be with the people. What do you think about that, and what is your message? How about encouraging mass demonstration at this moment?
There are Americans who were traveling abroad who were essentially stuck, unable to come home. We spoke to a group of 10 women who, Americans. 10,
Where?
Well, we spoke to 10 American women who were in Morocco, for instance. All the flights have been canceled. Their hotel is shutting down. They literally have no place to stay and no way to get home. They are asking you, they're asking the administration, the U.S. government for help.
Mr. President, two sort of foreign policy related questions. In your talk with the G7 leaders earlier this week, did you discuss together ending or postponing the Olympics?
Yeah.
And also on foreign policy, have you spoken to the leaders of Saudi Arabia or Russia and encouraged them to stop this glut of oil that is affecting the market?
What will the Carnival cruise ships be used for? Increased hospital beds?
At what point in the future will any American who wants a test be able to get a test? Because you're talking about not needing a test right now if you're not showing any symptoms, or only getting tested if you're showing symptoms.
Do you consider the term Chinese food racist because it's food that originates in China or it has Chinese?
No, I don't think it's
and
racist.
On that note,
I don't think it's racist at all.
on that note, major left-wing news media, even in this room, have teamed up with Chinese Communist Party narratives, and they're claiming you are racist for making these claims about Chinese virus. Is it alarming that major media players just to oppose you are consistently siding with foreign state propaganda, Islamic radicals, and Latin gangs and cartels, and they work right here at the White House with direct access to you and your team?
Can you just give a little bit more information about that, the process by which folks are going to be able to actually use these medicines? Because I believe there were at least 2 cited, maybe more. How quickly do you think people will be able to use them? And then if you can update us on the vaccine, I know it's fast-tracked first.
Well, the president has asked us to expedite this, and what I want to assure you, because of the questions that were asked, we want to make sure that this is done well and right for the American people. The president is right. With an off-the-shelf drug, we do have a lot of information about the side effects of the drug, so that really helps in terms of expediting. But I want to assure you that we're working as quickly as we can. I don't want to speculate about a timeline at this point. With respect to vaccines, that's in phase 1 trial, as I mentioned. We're expecting that to proceed moving forward, and we're working with a number of different other companies about vaccine
The
development.
president had noted phase 1 was fast-tracked. Is it possible phase 2 and phase 3 can be fast-tracked that we might see a vaccine before that year? You said it could potentially be a year.
This is a terrific question, and we are really trying hard at FDA to partner with great industry, great academic partners to do exactly that. No promises can be made, but one thing that we're doing is really working hard to fast track it.
Thank you.